Welcome back to another video. Sisterly conversation.
Very good. No, we're picking a topic. So the topic is Barbados' lack of EMR or EHR and the need for another hospital in the countryside.
Okay, so
Shanta will start.
I will start. First of all, EMR and the EHR. So that is
Electronic medical
right.
record.
Sorry, I even forgot it for a minute. Electronic medical record or electronic health record. And what's the question again? The lack of. So yeah. So basically, I have heard a lot of stories where people have been saying that um, home in Barbados, even the family members have been telling me this as well. Where they have to go from one doctor to the other doctor to the other doctor and repeat the same information. Sometimes they even have to go from one doctor to the same doctor or to the doctor, and they go to the doctor and the nurses, they have to repeat the same information to the receptionist or to the nurses or whoever. And there's nothing more frustrating than you having to literally repeat yourself every single time that you have to go to the doctor about a condition you have or a treatment you're getting, even from the doctor to the pharmacist as well. I've been hearing stories too where people go to the pharmacist and they have to say, the doctor signed me for this, and then the pharmacist is like, oh, well, that man got this on the prescription and this, and total ridiculous, totally ridiculous. Because the one thing you do not want to have to deal with as a patient is to have to literally fight, well, fight may not be the word, but you literally have to, like, you know unscramble the confusion of what the doctor says and what the pharmacist says and what the nurse says, and then having to repeat the information over and over. The same thing when you go to a doctor and you're experiencing a condition and you have to tell them what you're experiencing or the symptoms you're getting or whatever, and then let's say they send you to another doctor, you have to repeat the symptoms again, repeat the condition. It is very, very, very frustrating. So I believe that by now we should have an electronic system, because the next thing is sometimes doctors might write things on paper and it gets lost, and then you come to the hospital, or you come in, and then you have or sometimes people write things and misdiagnose you, or the one person writes something and somebody else writes something that doesn't even match up to the information, and you're like, what really going on here? So I believe that there should be a system where you have the doctor, where you have a record. That's what it's called, a record. You have a record where you have your information there, where the doctor, let's say you have a condition, the doctor is putting what your condition is, or whatever you would have told the doctor, then what his treatment was, and then if you have to go to another doctor, they put what their idea or what their thoughts or whatever is on the same record, right? And then if you have to go to a physiotherapist, they put what they have to put. If you have to go to the pharmacist, they put what they have to put. And then you as the patient can also go back and look for yourself. And fortunately here we have that system, and that's why I can talk about it so well, because I was a patient, as you know. I was diagnosed with endometriosis. I had a roller coaster ride with endometriosis. I suffered 7 years with that disease, and I'm coming up to my last 2 years before the surgery I had that removed the endometriosis of my body. It was a roller coaster. Like, it was ridiculous. I had so many doctor's appointments, so many. I don't even know what to say. It was just so much. I even had the case where, I had to get blood removed out of my abdomen, out of my abdomen. And I would go and I would talk about that another time when I discuss the endometriosis and what my journey was having endometriosis. But what I can say, because I have so many doctors. I had a doc, especially after the surgery. I had a blood specialist, a thrombosis doctor. I had the doctor. There were three types of doctors that performed the surgery on me. I had the gynecologist, the urologist, and the colon specialist, or the what do you call them? Yeah, I think colon specialist or whatever, right? So, and all three of these people, all three of these groups are these teams of doctors, because there were different teams. Each person had their own team. They performed the surgery on me, and I was able to look back at every single note that my doctors wrote about me. And then, like I said, and then I had to go to the blood specialist as well. I had to take injections for a good 6 months after surgery, blood thinners. And I had what my blood specialist also said about me. And then when I go to the pharmacy, I can say this. There was a time where my blood specialist had made a mistake on my record, and I was able to send him a message stating that this is like, I don't know what you're talking about here. This is not right, And he called me on the phone and he apologized and he said, I'm gonna fix that. Sorry about that, but I would not have been able to do that had I not been able to see my record. And some people might not like that idea because then they don't want the issues with the patient. But remember, the patient, you're caring for the patient, so the patient should also have a right to see what's going on with their situation. It shouldn't be hidden. If something real wrong with it becomes hidden. There's a problem. If you have to hide my medical care, then I shouldn't even be seeing you as a doctor or a nurse, right? And so I think it's so important because we're in the age of technology and everything is about technology. And you cannot possibly have paper trail. Paper trail gets lost, as I said before, and anything can happen with a paper trail. So the best system is that system. I don't know if my sister have anything to add on that.
I was wondering if I could have spoken. But
well, you go when you speak when I'm done.
Yeah, but what Shanita is saying is mightily true. What I will say that the issue we will always have when dealing with paper in my country is persons can be misdiagnosed. Persons can You might not be able to understand the doctor's handwriting. Speaking now from the nurse's perspective, you got some doctors that just write lines. They don't write words. You understand?
Yep.
And then you gotta hurt your head as to what they want. So then you gotta call them, clarify, and then some of them really unmannerly. And then why would I have to do that if you just put it inside the record on the EHR, the EMR, and I could just say, alright, well the doctor wants ciprofloxacin, or he want another augmenting any antibiotic, okay? But when you gonna write a line, it's not legible. And then too, as my sister would have said, you lose notes. So sometimes even something as simple as a lab, if you don't have the lab on the EHR, you're gonna find yourself in potter because now let's say you get paper, the paper goes missing, and then you don't know what the patient lab values, and then the patient could either be dying or the patient has an imbalance or something like that. You don't know. You understand? So those are stuff that need to be addressed in the healthcare system in Barbados. I find that even in terms of um, seeing pharmacy or stuff like that, like the written orders and stuff like that, the doctor want, he will call for one drug, and then that one drug is not available, and you gotta call another doctor to get another prescription. I mean, it's too much, But EHRs, I would say, is very important. The thing is, home now, the polyclinics are using it. Okay, the polyclinics are using it, but it needs to be updated. I think that that when you're working in the polyclinic, and it shouldn't only be in the polyclinic either.
Yeah, everywhere.
It should be everywhere.
This is
You know,
2025.
many times when I was working back home, you'd be calling the doctors over at the hospital because they did not write any patient's notes, or they did not give an order. They didn't say anything. You understand? If I got EHR or EMR, I just need to open it up. Boom, it's there. Cause see what the doctor say, how he feel about the situation, what's the new order, anything. So update the care plan, everything, and that's it. So I mean, it's very important to have your EMR and EHR, and as Shanita pointed out too, you as a patient must know your information. There are many times that clients would have picked up on certain things that
The medical
the
team didn't.
medical team did not. And yeah, you might say, man, she said no, it's blah 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 blah. But the reality is this is your health. And like how my sister had the mistake she had, if she was a panicker, she would have panicked. And she would get more sick again too. So I would suggest to my home country to get EMRs, EHRs, and make sure that the patients have their rights where they can view their medical records. Right? So that's what they just say.
And it's very important to rate where people can understand. But again, I just am not about rating, period.
Yeah.
Because I feel like rating is no. Rating is important, don't get me wrong. Rating is a skill and it is important. But in the time of technology and in this year of 2025,
Right.
there is no way you should be rating anything when it comes to healthcare. Right? It should be saved for a certain amount of time, and like I said, accessible to the patients. And then I think it can also prevent a lot of like emergency situations. There's some cases where I've heard horror stories where nurses, picked up the wrong medication and give to people because of writing that they might not even understand, or maybe because something was not as clear, a tag like a sticker, whatever was not as clear on the medication. That could be a late for that situation for a patient. If a patient is allergic to certain things,
Yep.
then is part of me personally. I'm grateful to not have any allergies. I've never had an issue having allergies, but there are a lot of people out there with allergies.
But even so with the allergies too, I like the system up here. So you're not going to remember, okay, Shanita's in bed 6, okay? She's allergic to penicillin. The doctor gone and write a thing telling you put the patient on penicillin. I recall or I remember that Shanita is allergic to penicillin. I gave Shanita penicillin. There we go, a big anaphylactic shock, anaphylaxis, all kind of story. I like that here in the hospitals, they alert you when the patient has an allergy, because that alert will let you know, okay, this is a danger to the patient. And remember, I always say safety first. Right? So I like that they do it here. So they need to do it in my home country too. Because especially with the nurse to client ratio, I know out here they complain a lot about it because sometimes you got one nurse or maybe 5 or 6 patients. Back home, when I was working in the long-term care, it was 1 to 16. Sorry, 2 to 16. And I was the charge nurse, right? So sometimes you got 16 patients that you got to worry about, but you don't remember everything. So if I get an alert that tells me, okay, by 12 is allergic to X, Y, or Z, the alert can tell me, well, okay, blah, 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 blah. But if you home and you got the paperless, I'm going to tell you,
all
hell break loose.
And I just have to say too, as a patient, and patients' family members as well, please do not be afraid to ask people what they're giving you in your medication.
Correct.
Like when you're in the hospital and they're about to like use the IV drips or whatever, and they're about to put medication in it, do not be afraid to ask, check, double check, and recheck. You understand? Because people can make mistakes. Nurses are working sometimes 12-hour shifts. and
6 or 7 patients.
Right, and sometimes they go sleepless, and mistakes can happen and things can happen. So they're not superhuman. Even though they do a lot and they manage a lot and they're very talented and everything else. But even if you as a patient, because this is your health, if you as a patient come and say, well, nurse, can you please tell me, like, what medication you're giving me or whatever, and they say, they check, they could be like, and they realize it's not even for you, that could be a mental, reminder for them. And as a nurse, like, if a patient had told me this, I would be grateful, because it's a reminder. Even let's say I had the wrong medication, I could say, oh shoot, let me grab the right medication or whatever. I mean, you might think about how you might get in trouble or stuff, but think about it. It's better to get in trouble for being reminded than to get in trouble for a person dying on your hands or something just because you give them the wrong medication. Like, we need to come out with this thing where, patients can't ask nurses nothing, patients can't ask doctors nothing,
all kind of stuff.
Or there's no respect. There should be a mutual respect level with your healthcare provider and you. And nurses also need to come up with this thing where, you didn't go to school, you're not a doctor, so you don't know nothing about your health. I'm sorry, but the patient is the best advocate for their own health, and they're also the best expert on their own health. You know why? Because even though they did not go to school and learn about all these professional things, guess what? They're experiencing the symptoms every day. They're the ones that are dealing with the sickness. Google is there, even though sometimes Google gives wrong information or whatever. People like me, if you're like me, I'm going to be researching because I want to know what's going on with my body. I'm going to be asking questions. I'm going to be joining support groups. I'm going to be finding out other people's experiences with the same disease, with the same condition. I want to know everything about it. You understand? So please don't degrade and don't look down on people that are patients because you think that they're not professionals. They're professionals in their own right as a patient. There needs to be a mutual respect between providers and patients, because if there is, healthcare will work wonders.
True.
It will work wonders.
And yes, we are all humans. Yes, we can make a mistake as healthcare providers, but I believe in listening to your patient. Your patient knows when they are ill, when they feel sick, when they feeling the greatest, or whatever. You understand? Especially in acute care. In long-term care, it's slightly different because there are some patients who can exaggerate or whatever. So you still gotta be mindful of that too, because it can be a behavior. But you see, acute care, I take acute care so seriously because you take long-term care seriously too, but acute care seriously because the patient knows what's going on. There's a difference when the patient is cognitive versus in cognitive,
or when they're not like aware,
are they not aware?
Like they're not there mentally,
right?
And you have to make a decision. But when this is an intelligent person,
right,
that going about their day to day and they're experiencing a condition on a daily basis, then you should definitely listen to them, at least to hear what they say. Their experience of their symptoms plus the medical experience of what's going on professionally definitely go hand in hand. Right. One is not over the other.
And I just wanted to give you all a little joke about this about going on Google all the time. One of my cousins, she said her hand was hurting her. She went on Google. She went on Google and she typed into Google, why is my hand hurting? And Google told her she's gonna have a heart attack. All I could do was laugh because it was too funny. Because she suffers with sickle cell anemia, so sometimes you do have pain all over in the joints. But my girl, her and Google thought that she was having a heart attack, but thank God she didn't have the heart attack.
Well,
right? But
for me personally, I knew I had endometriosis even before I was diagnosed with it, because I was looking at these symptoms, I was like, why am I getting these symptoms over and over, like, and it was becoming like a regular, like, every period type thing.
It was
you know. And I looked up my symptoms and I looked it up, and I remember asking a doctor, like, you think I have endometriosis? They said, no, you don't have no endometriosis because all of your blood, every test is coming back good, every test. And I was like, well, that making sense. And I even had doctors tell me, oh man, you had man, everything good with you, everything good. And lo and behold, not only did I have endometriosis, but I had endometriosis in almost every part of my body, in terms of my abdomen and my diaphragm and everywhere. Like, it grew, it spread, and it was crazy. All because, in the beginning stages, people didn't believe that that's what they had, because according to them, my tests were coming back good, right?
Yeah.
So I would definitely say, you have to be an advocate.
Yeah, you gotta be an advocate for your health, and one of the characteristics of a nurse is to advocate for your patient. And sadly, some of us don't do, some do. But we have to advocate for our patient, because sometimes our patients are so weak, and we have to be the ones to say, okay, this is what's happening to the patient, or whatever, or to the client, because up here they use client. But
well,
yes.
And then the other question I saw on the paper,
oh, yeah,
which is going to be very short, is that about Barbados having another hospital. I know we have like private hospitals and stuff where you pay for private care. But yeah, I definitely think that there should be another hospital in the countryside, at least, so that it could help, break at least half a half or something. Like people that live in St. Joseph, St. Andrew, St. John, even St. George, St. Lucia, yes, whatever, I don't know. But, somewhere in the countryside that it can take away from the people that are in town.
Right.
And that way there would not be so much wait times. The wait time will definitely be cut if you have half here and half here, and you have equipment there and equipment here, but I don't want to go too much into that right now, because this video is already 22 minutes. But you have any thoughts on that?
I just think that we do need a bit of help at the hospital, because we have over like 255,000 citizens in Barbados, right? And for everybody to just go to one place is too much. So they did open up fast track, which is at St. Vincent Scott. But my thing is, if you got minor issues, then yeah, go there. But when you got major issues, they're still sending you to the hospital.
Exactly.
So it kind of still ain't working.
There needs to be a hospital, just
actual
like
hospital.
the QEH.
Yeah, with the equipment and stuff like that.
So that some people can go here and some people can go there, and it cuts the people, like cuts the quantity or whatever. They cuts it in half at least, or at least it cuts it by a third or something.
Yeah.
So that you don't have this big influx of people at this one location, and then you have people waiting 48 hours or whatever amount of hours.
And then too, you've got seasons. Just like how the hotel got seasons, the hospital has seasons. So like times like crop over time, Christmas. What was the other holiday we got? Even like bank holidays or whatever, right? You gonna have an influx of, you gonna got people coming in, cause when it's not alcohol poisoning, it might be a crime, whatever. So all these things you gotta be aware of, and if you know that is a small issue, then go to fast track rather than going to QH or whatever. But as Shinji said, I do believe that we need a second hospital for sure, like a big hospital like QEH. Yeah.
So thank you for watching our videos. If you have any thoughts about what we said or your own thoughts surrounding the conversation, then just let us know and comment,
like,
and subscribe
and share. We still new to this, guys.
Alright,
so bye bye.
Bye.